So we've all heard the story, insulin resistance causes diabetes. But what if I told you it also causes heart disease, Alzheimer's disease, PCOS, fatty liver, even cancer? So we've all heard the story, insulin resistance causes diabetes. But what if I told you it also causes heart disease, Alzheimer's disease, PCOS, fatty liver, even cancer? Insulin resistance is not just a pre-diabetic warning sign. It's the hormonal spark behind almost every chronic illness in modern medicine. And most of us walk around with it for years or even decades without knowing. So, in this episode, I'm going to walk you through the 10 most overlooked conditions linked to insulin resistance, explain how insulin causes them, and what you can do today to stop the damage. So, welcome back to the Obesity Project, episode 48. My name is Dr. Mark Shankman, an oral and maxillofacial surgeon that took an interest in helping people's whole body, not just their mouth. So, what is insulin resistance? Let's clear this up first. Insulin is a hormone that helps you store energy. So when you eat, insulin tells your cells, "Hey, guys, we've got some fuel, we've got some energy. Let's use it or let's save it." But when insulin is elevated all the time from constantly eating too many refined carbs, stress, poor sleep, your cells start to push back. They say, "Hey, look, I've got enough. I've had enough. I can't keep any more here." And that's insulin resistance. It's not broken insulin, it's cells that are overwhelmed with energy or sugar, carbohydrate. The pancreas responds by pumping even more insulin, keeping fat locked in, blood pressure high, and inflammation smoldering in the background. So this silent dysfunction leads to damage in almost every system of your body. That's because insulin receptors are on almost every single cell in the body. Actually, they may be on every cell. So let's take a look at how this shows up. So first, we're going to talk about 10 chronic disorders, but we're going to start with the one most common one is type 2 diabetes. So we call it a blood sugar disease. But sugar is the symptom, not the cause. And that's what the medical profession sort of fails to sort of understand or comprehend about this disease is it's not about the sugar, it's about insulin. So the cause is years of elevated insulin trying to manage an energy overflow. So here's what happens. You eat frequently, especially carbohydrates. Insulin goes up constantly. Over time, your cells stop responding to the insulin signal. Blood sugar then starts to climb, and your pancreas tries to keep up until it can't. And this is why people often show up kind of normal on their labs until they're diabetic. Well, insulin resistance can exist 10 to 15 years before glucose ever rises, before it ever shows up on a lab test. And it's not about insulin not working. It's about the system being overworked for too long. All right, that's number one is type 2 diabetes. Now, number two, heart disease. These are the ones that are more commonplace. Insulin resistance wrecks cardiovascular health, even without diabetes. So here's the mechanism. Insulin resistance raises VLDL, or very low density lipoprotein, which is a triglyceride-rich particle, and it actually lowers HDL. So VLDL is a sort of a shuttle bus for fatty acids to travel around the body. And so it raises these VLDL particles and lowers the HDL, which is, of course, the good cholesterol. And then it actually shifts LDL, the sort of quote unquote bad cholesterol, to small, dense particles, which are much more likely to oxidize and form plaques. The small, dense LDL particles are actually the damaging ones. So it promotes endothelial dysfunction and causes the lining of your arteries to stop producing nitric oxide, which leads to stiff vessels. Without that nitric oxide, you're going to definitely get less compliant, more sort of stiff, that's the best way I could put it, stiff vessels. And it increases sympathetic tone or stress and increases blood pressure as well. So studies show that insulin resistance is a better predictor of heart attack than is LDL cholesterol. And I know this is a controversial topic, but honestly, there are many studies that actually show that LDL is simply a visitor to the damage. It's sort of like blaming the firemen for the fire. They show up because of the fire. Well, LDL shows up because of the endothelial disruption that occurs, and the LDL is trying to kind of plug the holes and fix the damage. So, in fact, 50% of people who have a heart attack have actually normal cholesterol. And it's honestly not the LDL that's the problem. It's that the insulin was never measured, and the insulin is the underlying problem. All right, number three is Alzheimer's disease, or otherwise now known as type 3 diabetes. So the brain is a very insulin sensitive organ. It needs insulin to metabolize glucose. And the brain is a huge sink, a huge draw on the blood glucose. So with insulin resistance, we get glucose uptakes in the neurons, the nerve cells, being impaired. So the cells of the brain cannot utilize the glucose properly. You develop amyloid beta, which is the plaque that's linked to Alzheimer's, and this plaque or this amyloid can't be cleared efficiently. You also get chronic inflammation, which damages synapses and cognition. So what's the result of all of this? You get cognitive decline, you get memory loss. I don't know why that was hard to say. So cognitive decline, memory loss, and early dementia. So studies show higher fasting insulin is strongly associated with Alzheimer's, even in people without diabetes. And that's why we now call it type 3 diabetes. It's a metabolic brain disease in disguise. All right, item number four, polycystic ovarian syndrome, or PCOS. PCOS is one of the earliest red flags of insulin resistance in young women. And here's the cycle. Here's what happens. You develop high insulin levels due to that insulin resistance, stimulates the ovaries to make more testosterone. And the testosterone is what leads to, the male sort of sexual characteristics, hair on the face and such things like that. It also lowers SHBG, which increases the free androgens in the bloodstream and in the body, which then turns and causes irregular periods, acne, ovarian cysts, and infertility. So up to 80% of PCOS patients have measurable insulin resistance, and many aren't even overweight. So treating insulin resistance with diet and lifestyle often restores ovulation, reduces symptoms, and even reverses infertility without hormones, or at least by adjusting your own natural hormone, right? Without external or extrinsic hormone that's injected. So item number five, or disease number five, fatty liver, otherwise known as NAFLD, which stands for non-alcoholic fatty liver disease, which now is the number one cause of liver transplant in our world. And it's happening in people who don't drink at all. For many, many years, the only people that ever developed fatty liver were alcoholics. And now there's an entire classification called non-alcoholic fatty liver because now, it's not just the alcoholics that are getting fatty liver, it's the rest of us are getting it as well. So what's the cause of fatty liver? Well, it's insulin telling the liver to make fat. And this is a process called de novo lipogenesis. So every time insulin is elevated, the liver converts glucose to fat, that de novo lipogenesis I just mentioned. And that fat gets stored in liver cells. And it wants to send some of this out, but it gets so backed up and there's so little transport occurring and so much fat being generated in the liver that it actually gets caught and trapped in the liver. So over time, this causes inflammation and then fibrosis, and then eventually leads to cirrhosis or damage to the liver, irreversible damage to the liver. And the sad reality is even lean people can have a fatty liver. It's not just about weight. It's about hormonal signaling, and insulin is the signal. All right, number six, erectile dysfunction. So we talked about PCOS in women. Let's talk about in men. Most men don't realize that their ED is metabolic. It's not psychological in many cases. Now, there are situations where it is, but for the vast majority of men that suffer from ED, it's a metabolic problem. So here's what happens. Insulin resistance causes endothelial dysfunction. Sound familiar? Similar to heart disease. Reduced nitric oxide causes impaired vasodilation. So the vessels are not able to dilate and increase in size. So you're not getting adequate blood flow. And decreased testosterone from hypothalamic suppression. So the hypothalamus has to do with the levels of testosterone in the blood, and you get decreased testosterone from this suppression due to the insulin resistance. We also see vascular inflammation, so inflammation in those vessels, and arterial plaque in the pelvic vessels. And often, this one is key, guys. If you're not paying attention, you need to be paying attention right this second. Often, ED is the first sign of metabolic disease in men. And very often, it's the first sign that you're actually developing cardiovascular disease. And ED, in many cases, is a predetermining factor for you to develop a heart attack later. So if you're under 50 and you're experiencing ED, insulin resistance should be the first thing that's tested for. All right, item number seven, or chronic disease number seven, is gout. Uric acid buildup in the cells is what causes gout. But insulin resistance is what prevents the kidneys from excreting that uric acid properly. And so you're getting this buildup because the kidneys are not releasing all this uric acid that's being generated. So high insulin levels reduce uric acid clearance, increase the reabsorption in the kidneys, make the gout flare-ups more frequent and more intense. And it's not about red meat. It's not about purines. Those things contribute, but that's not the main issue. It's about insulin and about insulin resistance. Now, fructose from high fructose corn syrup and soda, or fructose in juice or fruit snacks, is one of the worst offenders causing this problem. All right, chronic disease number 8, hypertension or high blood pressure. So high insulin levels increase sodium retention in the kidneys. So salt is retained in the kidney, which then draws the water to that sodium. Water wants to sort of dilute highly concentrated areas in our bodies. And so this results in higher blood volume. Also, vascular tone is increased by sympathetic activation. So our fight or flight system, the sympathetic nervous system, gets activated, increases vascular tone, creating tighter arteries and high blood pressure. We also see inflammation in those blood vessels and stiffer walls of those vessels themselves. So you can have normal weight, no diabetes, and still have high blood pressure because of insulin and insulin resistance. And you'll never know if no one ever checks it. All right, number 9, acne and skin tags. So insulin and IGF-1 trigger overproduction of sebum, which is oil in the skin. It also causes overgrowth of skin cells and causes increased inflammation, which then in turn causes cystic acne in teens and adults and creates skin tags in area like the neck, the armpit, and the groin. These are metabolic warning signs. They're not cosmetic issues. This is something that has to be dealt with and has to be dealt with right away. So if you see skin tags, it's time to check your insulin levels, not just cut them off, not just go to a cosmetic surgeon and have them removed. All right, and then finally, cancer, the big one. So insulin is a growth hormone. It's an anabolic hormone, and it stimulates several things. One being cell proliferation, which of course is the main activity inside cancer. Cancer is basically proliferation out of control. Insulin stimulates cell proliferation. It stimulates angiogenesis, or creation of new blood vessels that will supply the tumor or the cancer. And it also inhibits apoptosis, which is programmed cell death of cells that are not functioning properly. The body recognizes those damaged cells, marks them for termination, and they get eliminated. Well, insulin and insulin resistance inhibits that apoptosis. So chronically high insulin feeds precancerous cells and prevents damaged cells from dying. And there's a strong association that exists with breast, colorectal cancer, prostate cancer, endometrial cancers. Insulin doesn't just feed fat, it can feed tumors. So, okay, we talked about these 10 different conditions. Well, what can you do about it? So, if you've been managing belly fat, fatty liver, blood pressure, fertility issues, joint pain, and what if no one ever mentioned insulin? Then they've been treating and you've been treating symptoms, not signals. So the fix is simple, but nobody's talking about it, and that's lowering insulin levels. So how do you do this? It's actually quite simple. It involves lifestyle change. So you need to cut those refined carbohydrates and processed foods out. You need to prioritize protein and healthy fats. You need to stop grazing all the time. Embrace time-restricted eating. Eat 3 meals a day or 2 meals a day, and stop eating multiple snacks throughout the day. Give your body a rest. You need to lift weights and walk daily. Exercise is key. And then you need to sleep well and manage stress. All of these things contribute to lowering insulin, making you more insulin sensitive. And you don't need another medication. Let's not just throw medications at these problems. We're only covering up symptoms. We're not treating root cause. So you need better metabolic instructions. And the way to do that is to manage these things to lower those insulin levels. So in closing, insulin resistance is the root cause of modern chronic disease. It starts quietly. It builds slowly. It shows up in ways you'd never expect. And by the time you get diagnosed with diabetes, it's been there for decades. So let's go ahead and change that. The symptoms, they're all different, but the signal is exactly the same. And when you fix the signal, everything changes. So I want to thank you for watching this video. I want to give you a quick heads up on our next episode. We're going to be diving into a new paradigm of diabetes, where it's not that insulin doesn't work, it's that the cells are already stuffed. They're already full, and you don't want to miss that. So thank you so much for watching. I appreciate you. I appreciate your attention. Make sure to subscribe, hit that bell notification. Make sure you like, comment, share. Make sure let's keep the conversation going. I appreciate all your comments, whether you agree with me or disagree with me, perfectly fine. But let's keep that conversation going. Stay tuned for the next episode, and I'll see you in the next video.